Welcome to This Explainer. Let's jump right into something pretty incredible today. We are going to completely demystify the anatomy of the heart, but we're going to do it a little differently, through the highly effective lens of the visual arts. Whether you're a dedicated nursing student or just a focused learner wanting to understand your own body, literally seeing the heart drawn out, mapped, and illustrated just makes all this complex science suddenly click into place.
Here's a quick look at our agenda. First, art versus anatomical reality. Second, layers of the heart wall. Third, chambers and valves explained. Next, tracing the blood flow. And we'll wrap it all up with the rhythm and the beat. Let's get to it.
Section 1. Art versus anatomical reality. Visualizing our most vital organ.
So the way we illustrate the heart actually has a huge impact on how we come to understand its real form. For visual learners out there, especially med and nursing students, actively using hand-drawn anatomy sheets and coloring pages totally locks in that knowledge. Shading in these structures really helps memorize their exact position. And physically, the human heart sits right inside the mediastinum of the chest. It's nestled safely between the lungs, tucked right behind the sternum, in position just a tiny bit to the left of the center of your body. But okay, we've got to break a popular myth right here. We all grow up drawing that classic, perfectly symmetrical Valentine's shape, right? Well, anatomical reality is quite different. The actual human heart, which is about the size of your fist, by the way, is shaped way more like an inverted cone. And get this, it doesn't even sit straight up. It actually rests sideways. The broad top part, which is technically called the base, is positioned pointing toward your right shoulder. Meanwhile, the pointy bottom part, known as the apex, points down and to the left.
Moving on to Section 2, layers of the heart wall, the blueprint of our internal house. To really master this spatial visualization, it helps to treat the heart just like a house, to clearly define its structural boundaries. And hey, every secure house needs a good outer fence, right? Surrounding the heart is this fibrous sac called the pericardium. It acts as a protective boundary and creates what's called the pericardial cavity. Inside this cavity is a lubricating fluid. That fluid is super important because it prevents friction, meaning your heart can glide smoothly every single time it beats. Stepping past that protective fence, we hit the actual structural walls of our internal house, working our way from the outside in. First up is the epicardium. That's the outermost layer that actually secretes the lubricating fluid we just talked about. Next, we dive into the thick middle muscular layer, the myocardium. This is the crucial muscle doing the absolute heavy lifting of pumping. And why this matters clinically is because it's the layer susceptible to viral infections, like the Coxsackie B virus, which can cause a really dangerous inflammation known as myocarditis. Finally, lining the interior rooms is the endocardium. It's an unbelievably smooth layer covering the chambers and valves, making sure blood flows without hitting a single snag. All right, Section 3, chambers and valves explained, the rooms and doors of the heart. Now that we've got the structural boundaries down, let's step inside. When you look at simplistic hand-drawn diagrams next to full-color mapping, it brilliantly illustrates exactly how our internal rooms are divided. Visual study guides are essential here. You have two superior, or top chambers called the atria, sitting directly above the two larger, much thicker inferior chambers called the ventricles. And notice how the left and right sides of this house are completely separated by a thick muscular wall called the interventricular septum. Between these rooms are our doors, the valves, and these are strictly one-way doors, designed to absolutely prevent any backward flow of blood. We have the atrioventricular valves, separating the top and bottom chambers. On the right side, there's the tricuspid valve, named for its three strong flaps. Over on the left side, we have the mitral, or bicuspid valve. Then we have our exit doors leading out of the heart itself, called the semilunar valves, specifically the pulmonic valve and the aortic valve. Section 4, tracing the blood flow, the master pump in action. Before we map out that path, let's quickly clarify two totally crucial physiological terms, just to make sure we really get the heart's pumping efficiency. Cardiac output is the total volume of blood the heart can pump out in one full minute. Stroke volume, on the other hand, is the amount of blood pumped out during just one single beat. So keep that distinction in mind. Output is the minute, stroke is the beat. Let's trace the journey of a single drop of unoxygenated, basically used-up blood as it returns from the body. It plunges into the heart through the large superior and inferior vena cava vessels, landing directly in the right atrium. From there, it gets squeezed down through that one-way tricuspid valve into the right ventricle. Then bam! With a powerful contraction, it shoots up through the pulmonic valve and out into the pulmonary artery, racing straight to the lungs to pick up some fresh oxygen. Once that blue, unoxygenated blood hits the lungs and grabs oxygen, it turns a bright, vibrant red. It immediately heads back to the left atrium, drops through the mitral valve, and enters the left ventricle. Now, this left ventricle is incredibly thick and muscular for a very good reason. It has a massive job. It has to powerfully pump that fresh, oxygen-rich blood out through the aortic valve, into the aorta, and basically shove it forcefully to your entire body. Finally, Section 5, the rhythm and the beat, the electrical spark of life. So what actually tells that huge left ventricle to squeeze in the first place? Well, the heart runs on its very own internal wiring, known as the conduction system. It's this invisible electrical force commanding all that physical architecture we've just visualized. And it isn't made of normal nerves. It actually consists of specialized cardiac muscle cells. The whole thing kicks off at the sinoatrial, or SA, node. You can think of the SA node as the heart's built-in natural pacemaker. It fires off the electrical impulse, coordinating the rhythmic chamber contractions so the atria squeeze first, followed perfectly by the ventricles in complete, beautiful synchrony. That electrical spark is what creates the physical, mechanical beat we can actually hear through a stethoscope. The lub, the S1 sound, aligns perfectly with a phase called systole. This is when the ventricles forcefully contract, the atrioventricular valves snap shut, creating that lub, and blood is pushed out to the body. Then comes the dub, or S2, and that aligns with diastole. The semilunar valves close to stop any backflow, which gives us the dub, and the heart muscle relaxes so the chambers can fill up with blood all over again. Squeeze, relax, lub, dub. We've journeyed all the way from simple hand-drawn shapes on a page to understanding the dynamic flow of oxygen, and finally to the electrical sparks that keep us alive. Which leaves us with this final thought. How does mapping out these artistic anatomical diagrams translate into understanding your own resting heart rate? Just think about the lub-dub happening in your own chest rate at this very moment. By visualizing the chambers, the valves, and the fluid dynamics, you literally hold the blueprint to your own vitality. I highly encourage you to apply this visual explainer to your own vital signs. Keep visualizing, keep learning, and as always, stay focused.